Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about morphology of erythroid cells. Erythropoiesis, or the production of erythrocytes, is normally an orderly process through which the peripheral concentration of erythrocytes is maintained at a steady state. Erythroid maturing cells include those precursor cells in the bone marrow that are morphologically identifiable. If the maturation sequence of nucleated erythroid precursors, or erythroblasts, is normal, the cells are often called normoblasts. Normal erythropoiesis is characterized by the following progressive changes. Reduction in cell size. Maturing of the cytoplasm. As the cytoplasm gradually acquires hemoglobin, it changes from a basophilic to an eosinophilic color. Maturing of the nucleus. The chromatin strands gradually become condensed and pyknotic, nucleoli are lost and the nucleus is finally extruded at the orthochromatic stage. The resulting polychromatic erythrocyte still contains some RNA, which after 1 to 2 days, completely disappears and a fully hemoglobinized mature erythrocyte results. Using Romanowsky stains, the earliest recognizable erythroid precursor in the bone marrow is known as the pronormoblast. This gives rise to the basophilic normoblast, the polychromatic normoblast, the orthochromatic normoblast, the polychromatic erythrocyte and the mature erythrocyte. Pronormoblast is the largest and earliest morphologically recognizable of the Normoblast series. Pronormoblast is round to oval and about 12 to 20 micrometers in diameter with a high nucleus to cytoplasm ratio. The cytoplasm contains a large number of ribosomes and stains deeply basophilic. A pale area next to the nucleus, or perinuclear area, is sometimes apparent. This represents the Golgi apparatus, which does not take up the dyes of the Romanowsky stain. The nucleus is large and round to slightly oval. The chromatin is in a fine linear network often described as lacy. The nucleus contains 1 to 3 faint nucleoli. Basophilic normoblast is similar to the pronormoblast except that it is usually smaller and has a slightly decreased NC ratio. The cytoplasm is still deeply basophilic. In late basophilic normoblast, the presence of varying amounts of hemoglobin can cause the cell to take on a lighter blue hue or scattered pink areas. The perinuclear area is sometimes seen. The chromatin is coarser than that of the pronormoblast. Nucleoli may be present early in the stage but disappear later. Polychromatophilic normoblast is the last stage capable of mitosis. The cell is about 10 to 12 micrometers in diameter with a decreased NC ratio due to continued condensation of the nuclear chromatin. The cytoplasm is gray-blue colored due to the synthesis of large amounts of hemoglobin and decreasing numbers of ribosomes. The cell derives its name, polychromatophilic, from this characteristic cytoplasmic feature. The nuclear chromatin is irregular and coarsely clumped due to increased aggregation of nuclear heterochromatin. Orthochromatic normoblast. The cytoplasm is predominantly pink or salmon color but retains a tinge of blue due to residual ribosomes. The nucleus is often eccentric or even partially extruded. In late stages, the nucleus is structureless, pyknotic or fragmented. The nuclear chromatin is heavily condensed. After the nucleus is extruded from polychromatic normoblast, the cell is known as a polychromatic erythrocyte. It has residual mitochondria and RNA in the cytoplasm, which give the young cell a bluish tinge with Romanowsky stains. Polychromatic erythrocyte appears as reticulocyte when stained with supravital stain. The supravital stain allows cells to be recognized by the blue intracytoplasmic precipitate, ranging from the appearance of granules to a network of reticular material. The reticulocyte is slightly larger than a mature erythrocyte. The mature circulating erythrocyte is a biconcave disc measuring 7 to 8 micrometers in diameter with a thickness of about 1.5 to 2.5 micrometers. On a stained blood film, it appears as a salmon pink staining cell, as hemoglobinization is complete. Erythrocyte has a central pale area, or central pallor, that corresponds to the concavity and is about 1/3 the diameter of the cell. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.